If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you. All right. Welcome back to us. How you doing, man?
I'm doing well. It feels like it's been a minute since we've been together in the studio doing this.
Yeah. Sorry about last week. I just, the travel gods were not with me.
You're traveling all over the place now.
Yeah. It's been, yesterday I flew. I was in 3 cities yesterday. You know what I mean? From takeoff to landing. It was a day of 3 cities. So yeah, it's been a lot of travel lately, but good. This week I did a keynote in North Carolina at the North Carolina Primary Care Association. It's mostly community centers and CEOs of community centers. So, a great group, obviously, taking care of the most vulnerable. And did the same talk. I did it here on, slightly updated, but honestly not much, because like the updates would have been mostly about AI, and it would have been just too
more than people need.
More than people need. I'm kind of convinced that framework of replaying the last 5 years for people, from COVID, it's amazing how much it's gone over their head. And every time I do it, it makes me think about this show, how valuable it is for us to be talking about things from the perspective that we do, like not just what most other healthcare shows feel. It's funny. I feel like the whole moniker of healthcare is different. Really no longer serves this industry. Yeah, because now it's a cage. You know what I mean? And everyone's so trained to be in the cage, they don't even know they're in the cage, and they can't talk about healthcare without the whole nonsense filter of healthcare being different. Meanwhile, the world doesn't give a crap about healthcare being different anymore.
Everyone else is just going full steam into direct, health, working on healthcare stuff.
Yeah, exactly. Yeah. I mean, it's crazy how much in my non-healthcare podcast I'm now hearing about healthcare.
Yeah, that's right.
You know what I mean? Like, you're not a protected garden
$5 trillion
anymore.
A year. Yeah. And no one, patients, doctors, nurses, employers, politicians, no one thinks it's run very well.
No.
Yeah. I think that's right. The that protected, safe, protect me from regulation and competition that was so choreographed over 50 years. Has turned from sort of a protective walled garden to now a cage you need to get out of.
Yeah, exactly. There's arrows pointed at the cage.
Right.
But you know what? I guess my point is it's the double-edged sword of regulatory capture. Yeah. Right? Is you protect yourself through this, Byzantine labyrinth of bureaucracy that to where other people can't understand your industry, but now you can't see, but now you're so deep in the labyrinth, you can't see that people are setting ablaze to the whole labyrinth.
Yeah. Yeah, it's kind of like, maybe it's taken too far, but when the person at the zoo leaves the lion's cage open and the lion doesn't leave because it's so it's scary out there. That's sort of how health executives maybe are now. Yeah, they should just walk out into the sunshine, but then they have to start competing too directly. And sometimes it's safer just to stay kind of hiding in your cage and not subject to competition.
Yeah, and I guess the thing is when you are 4 or 5 trillion, whatever it is, when you're that big, the decline will be slow enough that in these people's careers, the people who are execs, it's actually not going to impair them. Yeah. And so they are now false signals. Yeah. You actually can't trust them. You get what I'm saying?
Yeah.
Because their personal interests are conflicted with the reality of what's actually happening.
Yeah. I mean, yes, the industry is changing and fracturing, but I'm on this big iceberg. Right. It's melting, but I'm going to retire in 5 years.
I got my parachute. I got my retirement plan. I got my blah, blah, blah. I'm not incented, truthfully, to say the reality, right? And then on the other side, right, so this is kind of what I experienced on Wednesday at the keynote. I think you have the people who truly do care about taking care of the most vulnerable, right?
Yeah.
But as we've been discussing on this show for at least a year now, the K-shaped economy plus the Trump administration plus the red wave that flowed through the election cycle, you're not getting the money anymore.
Right.
and like they don't know, like they have no entrepreneurial skills.
Yeah.
Right. That like
they don't know how to create it for themselves.
No.
Right.
No. So
they're just left to like yelling about how this is going to be really difficult.
Yeah.
We're both entrepreneurs. Like it will be okay in our sort of lower part of the K-shape delivery of healthcare in 20 years, but people are going to suffer a lot like during that process.
For sure. AI is the way out, which is crazy to say, but like it's kind of like it's the basic math that you're not going to be able to pay for the people and you're not going to be able to hire the people.
Mm-hmm. Yeah.
So you can scream and be mad all you want, but like I think those are two fundamental realities of the business model that are broken.
Right.
You're not going to get the money, and you're not going to have the people to do the work. They're not going to be there. So you're going to have to come up with new models to deliver the care, right? And when I say the people, I mean the people in the current operating model. I don't mean you're not going to have any people.
Yeah.
Right. But you're going to have to redistribute those people, and you're going to have to really make the operating model much more efficient. And that's where artificial intelligence is going to be incredibly important.
Yeah, no question. I mean, as you know, sometimes we need to talk about my book, because I really think that the capabilities, AI, but also crypto and biotech, just going to allow us to do probably 100, 200, 1,000 times more services, more capabilities than we can. Now, the time frame is hard, but it definitely in the next 5, 10, 15 years, a lot more capabilities. But how do we orient ourselves? How do we allocate those extra resources in a fair way? Needs to be figured out.
Yep. So. Agree. All right, man. I'm excited to run through a very short list of stories today. We've got a lot to do to end of the year here at Jumpstart, but we definitely want to, come back. Apologies to everybody from last weekend. Let's go ahead and dig in. So, jobless claims fell to new recent low per Labor Department. About 191,000 Americans filed for new unemployment benefits in the week through November 29th. Tell me about these numbers. First, let's start, Vic, with the fact that where did these numbers come from? Do we trust these numbers? Before we get into the numbers themselves, I want to just talk about the validity of the numbers. Are they delayed? Like what's going on with numbers coming out of BLS at the moment?
I can't say I trust them. I mean, all we have seen since COVID is that the Bureau of Labor Statistics is not very accurate. They revise the numbers often.
Yeah. And significant revisions.
Yes, significant. And so, no, I don't think we trust them. The reason we talk about it is there's not much else.
Right.
I mean, ADP is out there, but it's where I stopped using it because it's even less accurate, I think. So we don't really have, it's kind of like the drunk looking for his keys under the lamplight. Like, why are we talking about these numbers? Well, it's where the light is. It's all we have.
Yeah.
And so I think it is worth reviewing, but we need to take it with a huge grain of salt.
Right? I mean, okay, that big, I guess that was the main thing, because we didn't used to do that. Like we used to, when we talked about these numbers, it was like it was very, very influential into the way that we thought about the way that things were playing out in the country. And I just don't know that's we can do that anymore.
My belief, so this is not substantiated with research that I've seen that's credible. My belief is that the BLS is systematically wrong in really bad ways, right? So it is overestimating employment when the economy is slowing down. Mm-hmm. And then I think it underestimates employment when it speeds up. It's just like a lagging indicator.
Yeah.
And so it's wrong in the worst direction.
Right.
That's my belief of how it's structured.
Yeah, it's somehow counterbalancing the headlines that are coming out directly from industry, which are not in aggregate. They're anecdotal, right? You know what I mean? Amazon fired this many people. Omnicom, the big talent agency, right? They merged and then they've just let go of 4,000 people, right?
Yeah.
So, but those are all anecdotes. They're not They're not in aggregate. They don't tell us about the people who are being hired and how the math all nets out. But they're important, right? I mean, those anecdotes are becoming, to me, very, very important signal.
They're important, and they're more important when you don't trust the core statistics.
Right.
I think BLS is trying to smooth seasonality changes.
Okay.
And the way they do that ends up sort of like normalizing the data and reducing volatility.
Yeah.
In a way that I think systematically puts them in the wrong direction. But we need to, I mean, it's crazy that we can't find a better way than calling on the phone a bunch of people when we all know no one answers. Very few people answer the phone.
Right. It's like Nielsen ratings.
That's right.
All right. So now that we've done that critique,
it's a lower jobless claim.
Okay.
So fewer people lost their job and entered unemployment for the first time than was expected, which is positive. Means like it's less bad than we had feared.
Yes.
But the continuing claim,
but you have to offset that with
what I just said, which is it's probably not totally accurate.
Right.
And then the continuing claims, which is I think the more important number, continues to grow. We don't have estimates for that because they're not published, but that's like if you've been unemployed for more than 6 months and you can't find a job.
Right.
That continues to be worrisome.
Okay. Powell and the allies provide opening for December rate cut. A divided committee, missing data, and a whiff of stagflation leave Powell to choose between two paths, each with drawbacks. I mean, before we dig into what's happening here, I mean, we're at year end. It feels like a time to sort of reflect back on the year. I don't want to totally highlight the last 3 months because this is the Fed chair who's coming to the end of his term, navigated COVID, was responsible for a historic rate cut, increase. I would say getting much closer to Goldilocks than many people thought was possible. All sorts of people were screaming.
I mean, his 10-year term has been really a difficult set of years.
Yes. No question. In terms of like how much the political pendulum has swung over the course of those 10 years, and he navigated that.
I mean, the supply shock out of COVID was really damaging to inflation. And he tried to address, it's very hard for the Fed chair to address a supply shock inflation because it's a lack of supply of goods.
Yes.
But he did the best he could, I think, in that environment. Yeah.
So, I mean, I know you've been very critical about him from a data and a looking back and not being as aggressive and all these types of things. But, I do sort of wonder on balance over the course of the last 10 years, whether or not we can say he was a net positive.
Yeah, I mean, I think he was maybe a C in a grading scale. Like he did an okay job.
Okay. So let's talk about one other thing. He inherited ZIRP, right? He didn't originate ZIRP.
Yeah. ZIRP started in the Great Financial Crisis,
right? And
the next 10 years, he wasn't there.
Yeah. So he inherited ZIRP, and he kind of ended ZIRP, too, which is going to be another big part of his legacy, right?
Yes.
So what do we think about that? I mean, ZIRP was really fun for us, private equity venture capital folks. And so it has not been the most fun last 5 years, but probably ZIRP, the party needed to come to an end at some point, right? I mean,
I mean,
zero interest
rates. That's exactly what I was going to do. Zero interest rate policy is helpful in hiding weaknesses in the economy.
Mm-hmm.
Lack of innovation, lack of creation of new products, new jobs, new things. And you can sort of prop up the economy, but you can't engineer your way to growth forever. I think that you need people and companies to make things and do stuff. And so, it had to end at some point, and the time to end it was, I think, when he ended it. In post-COVID, there was a supply chain issue that drove prices incredibly high, really painful for a lot of lower-income folks. And that was the time to end it. I quibble over sort of how he phrases things and his claiming to be lack of having enough data when he has more access to data than anyone else. But overall, I think, yes, he did a pretty good job. Maybe it's a B. I mean, I think there was an opportunity to do a lot better, but that might be unrealistic given all of the political needs of that seat.
Yeah. I think we have to give him credit for the difficulty of the era that he faced, right. and probably some of the important, hard and unpopular things that he had to do during his time. So, I think that's important. And I guess the reason why I wanted to say that is because he's kind of going out with a whimper, right? Which is to say his committee is divided. Everyone's not talking about this. They're mostly talking about the next, Fed chief who's already signaling that he's going to be, cutting rates and he's crypto friendly and all those kinds of things. I'm seeing, murmurs on X that Bessent is not just going to be, Treasury Secretary, but also special financial advisor to the president, which is just sort of a total stack deck alignment, of America's financial apparatus, under the executive office. And so right now, most people are just like, whatever, Powell's going to be out of here in 3 months. Right. It kind of doesn't matter anymore, right? What do we think about a December rate cut right now? What's Polymarket saying? Do you know?
Yeah, quarter point cut. 80-ish percent.
80-ish percent, okay.
But I think it's very likely.
That's a lot. That's a lot.
I think they already have ended QT, but they'll announce
They did. Okay, they announced they officially ended it, yes.
So they're doing a quarter rate cut, I think, and then they already ended QT. I think it's fairly certain that the next chair is going to do a few cuts before the midterms. And so we're looking at a dovish trend.
Yeah.
But also inflation is pretty moderate.
Right.
And the PCE came out today, which we're not covering because it just dropped as we're recording. But when I looked at it just for 30 seconds, it looked pretty low, under 3.
Right.
I think in general, it's not healthy to intertwine so closely the office of the president with the Fed chair.
Well, it's been,
but it's already over. I mean, that's been done.
Yes. I mean, we're breaking a huge convention,
that's
with what's about to go down next year. No question.
Yeah.
No question.
Right. So that might be difficult in a 10-year view, but right now it's going to be lower rates.
The markets will probably love it.
Markets will love it.
Private equity will love it.
Yeah. There'll probably be okay jobs holding on, and then we'll see what happens in the midterms.
Yeah. Yeah, I don't know about the jobs holding on because I think AI doesn't care about any of that, right? I mean, I think one of the big things we're going to have to sort of rewrite is we've had a very, very strong correlation between labor and productivity, but that's always been human labor.
Yeah, right.
And we're now shifting to artificial labor, digital labor, which is actually going to be more productive.
Yeah,
it's going to
drive productivity gains.
It's going to drive productivity gains while jobs are lost.
So jobs are lost and earnings, hourly rates and corporate earnings. Earnings to a person, like weekly paycheck, is going to be decreased.
Yes. But corporate earnings are going to increase.
Yes.
So that's it's like that's kind of a fundamental reboot of economic norms.
Yeah, that's right.
I don't want to call it first principles because I don't believe it's first principles because these were always immutable levers. I mean, these were never immutable levers. They were always things that technology had the potential to change over time. They haven't changed for a long time, right? They haven't changed for a long time.
I didn't bring it in, and so just from memory, I can't fully do it. But there is a chart sort of showing the share of profits and economic gain between capital owners and labor providers. Mm-hmm. And it's been sort of 60-40 in that band going up and down based on, capital providers in the late 1800s, early 1900s started getting like a little bit over 60%, and then unions came in and sort of corrected that.
Yeah, okay.
And it's been in that range, and I think we're going to challenge that or relook at that.
100%. 100%. No, it's. I mean, we are moving into a big time capital allocation economy, I think.
Yeah. And in the past, labor through different means has responded. And I don't know how they'll respond, but probably people before labor unions didn't expect labor unions either. It's going to be...
They're going to, but I mean, before the threat was strikes.
Yeah, right.
Now, strikes are not a threat anymore. You're going to have to come up with a new threat. I mean, it's going to have to be truly democratic action.
Yeah.
You know what I mean? It's going to have to be policy. Like, you're going to have to try to get politicians in place that are going to regulate against AI. You know,
they're going to regulate against AI. They're going to tax revenue or wealth, depending on whether you're talking about corporate or individual. And that's going to be a fight.
Yeah.
And I mean, I'm not sure where I come down on the fight. I mean, you need to have your population be able to pay for things.
Yeah.
And as I don't know if we're talking about it on the show, but we've talked about it privately. There's not going to be a lot of profit. There's no incentive to make profits really in the AI world because they're taxed. So people are going to shift cash flow and profits offshore, or they're just going to grab market share and get power and then worry about.
I think for now we're in the market share grab of the market shift, right? Just like Amazon for a very, very long time was not profit oriented. It was in market capture mode, right? This is effectively like you can just look at the Amazon pattern and just apply AI to the Amazon pattern and say like that's basically what's going to happen. They're just going to reinvest in market capture and destroy and destruction, right? You know, and value destruction. Of existing entities.
business
entities. Yes. Value destruction of existing business entities. Yes.
And so politicians will respond to that by finding new ways to tax. But that's going to be an arms race kind of thing.
That's going to be a fight within the Republican Party because that's not a fundamental Republican principle at all.
No, I don't think the Republicans are going to lead that.
Well, the Democrats are too weak right now. So,
well, I mean, I'm not talking about more like over the next 2 or 3 years.
Yeah, I mean, the Dems are not. So I don't consider Mamdani to be proof that the Dems are viable yet. There's still a lot they have to sort of prove to me.
They're not viable, but I think that's the path. Well, I don't know. I mean, I'm certainly not setting the path for the Democratic Party, but
I don't.
There needs
to
be some way to support the ability of people in the bottom half of the net worth of our society, which is a lot of people. I mean,
listen,
100 million people or something need help.
Yeah, so I know. This is what I was talking to the people in North Carolina about on Wednesday.
Right.
I mean, I don't have the answer to it because it's
you do. Your book is the answer to it, really, but that's not a societal answer. That's an individual answer.
Yeah, and like, you know, this is what happens when you have more than a century of embedding the value of, you know, higher education and career, quote unquote, employment is, you know, entrepreneurship seems like, you know, witchcraft, you know, and so instead of the fundamental American model of how you operate, right? You know, we've institutionalized higher education and employment as the normal, right? As opposed to actually participating in full contact economics as an entrepreneur. Yeah. And so what I have experienced, you know, in the 5 years that my book has been out there is people get it, people read it. But it doesn't change.
Well, it's hard work.
People's orientation. The book doesn't change people's orientation, I guess is what I'm saying. So I'm simply positing that it's not the answer, right? You know what I mean?
People are going to reach for an easier answer than that.
100%.
I think entrepreneurship is the right path, but it's not a path that politicians can do.
I don't see an alternative to it.
That's right. Yes.
I don't see an alternative to it. I'm not nearly as worried as the majority of people I know in this moment, and that's because of my competency as an entrepreneur. Right. You know what I mean? Like, so it's not that I'm better than most people at all. So there's no fundamental.
No, but for 20 years you've been practicing the step-by-step practice or discipline of what an entrepreneur has to do.
Yes.
And it takes maybe not 20 years. It takes a long time to learn that and get good at it.
Yes.
And if you don't have that, I think you would be scared.
Yeah, it's amazing how, it's I don't even know if we're going to get through all these stories, Vic. I got to tell you in the show, because we're going to end where we're going to end. But like, it is amazing how fundamental this like civilizational rewrite that we're currently under is. It's like I got to get one of these events. I'm going to be doing this keynote like 6 times next year. I got to get it recorded so I can get it published, because
I saw a pirated copy of one, but we can't publish it broadly.
Well, we can't publish it, and also the audio was really bad at that one, so I need to get it like properly recorded. Yeah. It's amazing how simply recalling modern history, like with no opinion, right?
These are facts. You lay out, I'd call them historical facts.
They are. Yeah. They are. I'm literally like, okay, then this happened, then this happened, and then this happened. And like, you should see these people's eyes. It's like, what world are you living in? Oh, you're living in the world where you still watch cable news. Yeah. You're living in the world where you don't listen to podcasts. You're living in the world where, because of your political beliefs, you won't go on X. Right. And so all these, just because you don't pay attention to it does not mean it's not reality.
Right. Not happening.
Yeah. And so it's there's just, I don't know.
Yeah. Well, let's jump to the policy, because I think that will dovetail with what we're talking about.
All right. Sounds good. So HHS repeals staffing mandate for long-term care.
At the very bottom of this, Oz has a good quote, which I won't be able to do exactly, but let's read it.
Let's find it.
The very bottom here.
Okay. I'll read it. Okay.
Yeah, go ahead.
So CMS Administrator Dr. Mehmet Oz says, at CMS, our mission is not only to improve outcomes, but to ensure those outcomes are achievable for all communities. We cannot meet that goal by ignoring the daily realities facing rural and underserved populations. This repeal is a step towards smarter, more practical solutions that truly work for the American people. I mean, I agree with that.
Yeah. So what they did is they rolled back the nurse staffing requirements at nursing homes and other kind of long-term care facilities. And the reason I wanted to start with the quote is
because the mandates are not reasonable.
The mandates are not being met. They're not reasonable. They're not being met.
Yeah.
The nursing homes don't have the money to pay their rates that would attract people.
Right.
They're not functionally possible.
Yes.
That's what Oz is saying. Is that
you put constraints on the P&L that cannot that mean these businesses can't operate.
Right. Exactly. And that is an interesting shift for our healthcare policy. Like that, I haven't seen a leader say anything like that before the Kennedy administration.
Yeah.
And it's just sort of symbolic of the shift you're talking about.
It's part of the shift.
Right.
It's part of the shift, right?
Yeah. This is not a sort of a protected thing that this is the ideal and we're just going to fund this until it all works. What they're saying is you got to reinvent things, but we're going to reduce these regulations and then encourage you to do it in different ways.
Right. So, there's multiple ways in which this reflects the shift, but I want to quickly talk about the importance of entrepreneurial thinking, right? And I think entrepreneurial experience, right, in terms of how you process something like this. Yeah. Entrepreneurs understand that P&Ls are like gravity.
Yeah, right.
You know what I mean?
Right.
We understand like you cannot, operate in the red for very long.
Right.
That's not you cannot do that, right? And employees sometimes understand that, but often do not.
Yeah.
Often think of businesses from as like moral agents that need to act out certain moral requirements regardless of P&L realities. You know what I mean? And so this kind of statement, this kind of thinking, regardless of what side of the aisle you fall, this is where it's like, it's not about your political orientation. I think it's about your exposure to and the depth of your understanding of economic realities. And unfortunately, too often the Republicans are associated with that. Right. Whereas the Democrats are less associated. This is one of the things I was explaining in my keynote. I was like, I put up 3 charts in my talk, as you know, one chart is the whole Pelosi inverse Kramer chart that gets a laugh every time I do it. And then, the second one is the national debt. And I kind of make the point. I'm like, I never hear people on the left talking about the national debt.
Right.
As if there is not serious moral issues with this for what you're doing for future generations.
I mean, my view is that there's a reinvention of the political infrastructure in the U.S. that has to happen. The Republicans have already gone through it with the Trump MAGA populism thing.
I would say it's not done.
Not done because Trump is his own thing.
They are not done.
Once he exits, they have to continue that process.
The whole thing is happening, right?
Yeah.
On the left, you've got Mamdani,
yes,
right? You know what I mean? On the right, you got Trump.
And Bernie.
So
it's going on. I think the Dems are
going on
2 or 3 years behind the Republicans.
I agree with that.
Because Trump is a force of nature and sort of
and the Dems have not had the force of nature
yet. They haven't had that yet. And I don't know if Mamdani is it or not, but they need someone like that. He's the closest thing so far.
He's the closest thing so far.
Right.
AOC was the closest thing before that. And Bernie was the closest thing before that, right? So, I mean...
Yeah. And so I don't think it's a right or left thing. I think it's like a upswelling of populism from both sides.
From both sides, correct.
And that will tear down or challenge the status quo at least.
Yes. It's not constructive.
It's not constructive, but it's sort of a process we go through every 4 generations.
Yeah, we're in it. 4th turning. Okay, anything else you want to say about this?
No.
All right, FDA official pledges new vaccine standards. In an email, RFK Jr. ally cites childhood deaths after receiving COVID shot, but provides no evidence. This is the Wall Street Journal. I think it's important to credit that headline. Yeah, I saw a bunch of stuff this week on X about, RFK and the vaccines. I mean, the
committee is meeting yesterday and today.
Yeah, but I mean, early in his tenure, one of the very first things he did was he blew up.
Yeah, he blew up the committee. This is his committee that he has stacked with all people he brought in.
It was one of the first things he did was he blew up this committee. So I think this discussion of the COVID vaccine and how it maybe there seems to be evidence that 10, 20 children died due to it. Now, a lot of children got the vaccine, so I don't want to comment on whether that's right or not. And there's lots of fights both ways. I see it as a red herring. I mean, they really wanted to sort of do the Hep B change, moving it out of the labor and delivery into the pediatric office. And I think this was sort of a red herring to sort of get all of the fight going on this. And then they're going to come with, I think today, they'll change that policy. Mm-hmm. But either way, it's sort of another piece of the healthcare sort of, regulatory body shifting. Mm-hmm. Mm-hmm. Yeah, I mean, to me, honestly, like this is more of a public health thing, and we don't talk that much about public health because it's a little hard to talk about it in the context of investing, and it will be a political football that just gets kicked back and forth. I mean, you know, that's about what I can say about that. The House votes to extend acute hospital care at home. Senate needs to vote to extend program past January 30th, 2026 deadline. So this is a pretty important one.
Yeah, and I don't know anyone that I can think of off the top of my head that is against this.
Right.
It was done until January 30th. We need to extend it. It's great the House has done it.
Yep.
The Senate, I think they will extend it, but January 30th is not that far away, and they're fairly slow up there. So
yeah, I mean, to me, it's I think the importance of this story is just to sort of understand that this hospital at home is apparently like not codified, like it's not.
Yeah,
it's not a long-term going concern at the moment. Yeah, these are still sort of experimental things that need to kind of be reauthorized.
Yeah, and it's because of the dysfunction in DC. It's not that anyone doesn't think telehealth or hospital home is something we should do.
Yes,
it just we can't get anything passed up there.
Yeah, and you think about how that dysfunction plays such a huge role in the ability for entrepreneurship, investment, and innovation to actually help healthcare, right? Yeah. You know what I mean? Like it does kind of put a spotlight on just, okay, forget us because we're small, compared to like big PE firms, right? Mm-hmm. But I mean, when you're looking at the need for this to be reauthorized, can you really deploy big capital and the the brightest minds and the best executors on business models around this, even though this is better for families, better for individuals, probably, more affordable, gets the hospitals less dependent on their big real estate, purchases and things like that. It's clearly something we need to move in the direction of, and not for everything, but a lot of things.
I think that's right. The government needs to set the rules of the road, or what is allowed and what's not allowed. That's the very basic thing they have to do. And then publicly traded companies, large nonprofits, private equity, venture, everyone then knows how to deploy capital and operate.
Right.
That's the only thing they have to do, and that's the thing they can't do.
Yes, and therefore we
can't really deploy capital in the same way that we would be able to.
Yeah, exactly. All right, Mark Cuban's Cost Plus Drugs, Humana, exploring a partnership to tackle employer drug costs. So the reason to bring this story up is not as much the partnership as what is Humana doing talking about employer drug costs.
Right. Yeah, Mark Cuban has the same story he's had for several years. I'm in favor of it, but there's nothing
100%.
new on that side.
100%.
Humana partnering with him to help employers save money on drug spend got my attention because they don't work with employers at any scale.
Not that we know of.
Not that we know of. That's right. So they are mostly a Medicare Advantage platform.
Yeah.
And what they say in here is that CenterWell, which is their provider services, I thought mostly to seniors.
That's what I thought.
Is going to now go across all different demographics, including employers.
Yeah.
And that was surprising to me. And it could just be that Mark and someone from Humana were on a panel together and chatted before and did this, or maybe they did the panel because they want to announce this. It's hard to know, but I think we should watch it because Humana is big and it'd be great for them to broaden, but it would be a marked change in their strategy.
Yeah, I mean, I think it's really interesting. Humana has done, as I think we've covered, has done a pretty good job of navigating the headwinds targeted at Medicare Advantage.
Yeah.
They haven't really been under fire for bad behavior in that space, right? And they've
they don't have a PBM.
They don't have a PBM, so that's
good. Why they can do this,
right?
Yeah.
And having said that, Medicare Advantage is generally under fire, right? Which is their fundamental business model on the payer side. And as we know, all payers are struggling with their MLR, Humana included.
Yeah.
And so, that probably elevates the importance of CenterWell, period, within their business model, and probably even more so elevates the importance of taking those assets and starting to direct them away from being 100% concentrated at seniors.
Yeah. Well, and the thing that I'm looking for, but I don't know one antidote doesn't make a trend. But if they could be the payer that begins to move into the payvider business model in a meaningful way, previous to this, United and Elevance were sort of there.
Yeah.
United is really impaired, and I hope they come back. I mean, we have a lot of friends at United. There's a lot of good people there, but they have a lot of trouble too.
They have stuff to work through.
Yeah. But if Humana is well run, if they move in to start really focusing on their provider side, in addition to their payer, it could be interesting. Yeah,
it's interesting. So it's something to track. HIMSS Hers expands into diagnostics, moves into Canada as it evolves its DTC telehealth platform. Talk about a brand that's just continuing to expand and become a first-class healthcare company.
Yeah. They're really working at being now a global healthcare brand.
Yeah.
Whatever you need, I think their vision is you come to HIMSS Hers and get what you need. They bought a lab company, I think in Boston, somewhere in the Northeast, to sort of get into diagnostics, and it makes sense. I mean, they're executing pretty well.
Yeah, and I think they are DTC, but the more that they expand, there's going to be an opportunity where they will be able to sort of, I think, pivot into selling to employers.
Yes,
right, which is a completely different equation in terms of the scale of what this company can become.
Yeah, I mean, I think there's that's the natural place where they'll go. But they haven't done it yet.
No. All right. So Health and Us, you found an opinion story here from the New York Times. The story is titled, "We Had No Idea What Was Coming, Caring for My Aging Father." We debated whether or not we keep it in because it is a short show, but I wanted to bring it in, A, so that we link it in the show notes, but B, just because I had no idea what was coming when it was time for me to care for my aging father. And I'm 49, about to turn 50, but my parents had me later in life. I'm their baby, but my oldest brother, who passed away earlier this year, was 70 when he passed away, right? And so, my parents are they're up there.
You're younger than I am, but you are dealing with this earlier because of that dynamic.
That was the point of me saying all that. And so I think the reason why I wanted to bring it in is I think a lot of Gen Xers have not quite gotten here yet.
Yes,
but it's coming
soon. Yeah.
It's coming. I don't think most Gen Xers have any idea about how disruptive and how expensive and how hard this process is.
Yeah, that's right. That's right. Which is why we keep talking about it.
Yeah,
because it's not a fun thing to think about. I know I push it off, and then I see a story like this, and it's coming for all of us. And one of the aspects that is in this story, but it's also just a fact, is that Alzheimer's and dementia, a lot of people can hide that and cope with it and kind of offset the mental deterioration because they have enough capacity to do it. And then they have another health thing comes, and all of a sudden everything cascades down, right? You get another, in this case, I think it was a cancer diagnosis. And so the father, all of a sudden, he was trying to deal with cancer. And also, it all sort of happens much more quickly than you would expect if you weren't paying attention and reading these opinion pieces and listening to us and thinking about it. And so you can go from everything seems fine to needing a lot of care for your parents pretty quickly.
Yeah, it's a really big cliff. Like when it happens.
Yeah.
First of all, you're hurled in time-wise, work disruption-wise,
and it's emotionally scary. And sorry,
I was going to get there. I was going to get there. And I think your immediate thing is it's an emergency, right? Mm-hmm. Whenever the thing happens. So you go into emergency mode. You don't hit emotion right away.
Yeah. It's just sort of firefighting mode.
Yes, you're firefighting immediately. And then the emotional piece comes in.
Yeah.
And it has all these implications, many of which are just part of life. Humans have been here for millennia. So, it's like we're not going through anything that every other human, every other generation hasn't gone through. But I do think the way that we live now is new and is different, right? We're not as communal. We're
spread much further
apart. I was really lucky. My parents, being old school, kind of moved to me 17 years ago. Right. So when this all went down, they were here on my turf where I was able to help. Yeah. But, you just start adding on to hey, how strong is your healthcare knowledge? How strong is your healthcare network? How strong are your finances? How much control of your time do you have? Right. I'm an entrepreneur. I can, if they called me right now, we're ending the show, Vic, and I'm going.
Right.
You know what I mean? But everybody can't do that.
Yeah.
And so
that's right.
I guess, the point of putting this in here is just to sort of say that I think this is going to be a pretty traumatic wave. We always talk about the silver tsunami and what's going to happen over the next 10 years with care for the, for the boomers and everything like that. We never talk about Gen X, period. Right. But we really don't talk about the trauma that I think our generation is about to go through.
That's right. And it's, I haven't been through it yet, so you need to comment, but there's that firefighting crisis where there's adrenaline and you're it's all hands on deck just to deal with what we're facing right now. And then you have this emotional thing of, gosh, if my parents die, my own mortality, and there's a lot of fear and sadness and emotional things. And then there's a long term, your parents going to be alive for several years in this state where you need to help them. And so it's an ongoing, almost like an endurance thing that becomes really hard.
Yes. And then there's two other things I'll bring up.
Yeah.
One is you will be interfacing with the healthcare industry.
Mm-hmm.
Okay.
Yeah.
And it's like, for me, this is one of those things where it's like, this is where we stop listening to people in the industry and their complaints and blah, 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 because it's like, despite best efforts and despite the best intentions and despite this industry having some of the absolute best people, the system sucks.
Yeah.
You know what I mean? And so, like, I'm not mad at the people.
You're not helping my dad or my mom.
Correct.
Yeah.
I'm not mad at the people, but my God, this system, like, this system deserves no, like, reverence.
Right.
You know what I mean? Like, it's fine, I suppose, but, like, it absolutely needs overhaul.
Yeah,
There's no question about it. And then the other thing is, and this is something you can kind of get out in front of, so maybe this is a little bit of a PSA.
Yeah.
I think the easiest way to sort of frame it up is in 3 words: power of attorney. Your ability to act on behalf of your parents and unravel get information and get access to their finances, get access to, it's like, whoa, you know what I mean?
Yeah. And my wife's trying to do that with her mother right now. And for the senior doesn't always want to give it.
It's a relinquishing.
Yeah, right. Yeah. You're giving up power over your own future, which is at least scary. Yeah.
Yeah. So, there is a lot to this.
Yeah.
There is a lot to this. All right, let's run through these AI stories. Yeah, we have one crypto story. So Texas put $10 million into Bitcoin as Bitcoin fights to hold $78,000 support. Bitcoin is continuing to sort of suffer from the liquidity stuff and the global, Japan interest rate stuff is going on. So there's a lot of like global liquidity stuff that's impacting the Bitcoin price. I'm pretty long Bitcoin. This is not investment advice.
Yeah.
I'm just simply, disclosing my view on it. Is Texas the first state to do this?
Yeah, first state. They're the first state to actually purchase Bitcoin.
Put it on the balance sheet.
Put it on the balance sheet.
Yeah.
So symbolically, I think it's worth noting.
Yeah, they bought it through an ETF.
Yeah.
So they bought it through a more sort of traditional model, but it's backed by Bitcoin.
Right.
So, and they planned $5 million of self custody. So, that's part of the 10 million.
Right.
So that's
and other states are also working on it. There's just a lot of
I'm sure Wyoming and Tennessee and other sort of crypto friendly states are working on it. All right, we got 3 AI stories. The first one: OpenAI declares code red as Google threatens the AI lead. Company-wide memo is the most decisive indication yet of pressure OpenAI faces from competitors. This is not a "I told you so" moment. It's, for me, it's more of a like, I just don't know why anyone ever questioned whether or not Google was going to be able to pull this off. I think from day one, we basically said Google invented the transformer.
Right. They have DeepMind.
They have DeepMind. They have the TPU chip. Like, this was always going to happen. Always.
Yeah. And the surprising thing to me is not that Google leapfrogged them or that they are scrambling, but that the Sam is so public about saying this code red and cutting all those other projects and just kind of refocusing on ChatGPT, because it is counterproductive, I think, to what he's trying to do.
Welcome to the big leagues.
Yeah. So he jumped
right in there with the absolute sharks, right? He had a decision to make. He could have aligned with Microsoft only.
Yeah.
Right. And probably had a lot of safety, but he wanted to compete with Microsoft.
Yeah. Right. Which
that was the bet. That was the bet as a CEO that he made. And he bet on the brand of ChatGPT and bet on himself to be able to, take everybody else out.
Yeah. And I think it's the beginning of the end, but we'll see. I mean, there's going to be a lot more innings.
I don't use ChatGPT, and I don't use it because I don't trust him.
I have an account so I can test it and play with it, but I don't use it. It's not good enough for me to use.
I have an account. I pay for an account, but that's just because I'm one of those guys who just pays for too many accounts.
Yeah.
My first go-to is Claude, and this is before Opus 4.5, which we're going to talk about.
Yeah.
My first go-to is Claude because I like Dario.
Yeah.
You know what I mean? And then my second is Google, because I'm a Google guy. We use Google Workplace and
we're on Google Cloud, Gmail,
right.
Drive, everything.
Right, right, exactly.
Yeah.
And then from there, I just use sort of a bevy. I actually use Grok for real-time search. That's my real-time search is Grok, because X is the highest signal network in America right now. It's not even close. And then Perplexity for like kind of research things. When I want like a graph generated or something like that, I use Perplexity. So ChatGPT is like fifth for me.
Yeah.
Which is, and I don't have a good use case for it, right?
Yeah. Like there's no use case where it's the best tool.
Not for me.
The only use case is if you're not aware of other tools and it's the only one you know.
Right.
It's better than not having AI at all.
Right.
Certainly.
Right. And everyone keeps saying like they're great at product, and I'm like, I don't understand. It's a chatbot. I don't understand. Like when you say it's great, they're so great at product. I don't understand what that means. So speaking of Anthropic and Claude, Anthropic introduces cheaper, more powerful, more efficient Opus 4.5 model. This model is unreal, Vic.
Yes. This is what I use.
This model is unreal. So I need to send this to you, but I saw, I was listening to Moonshots, the Peter Diamandis podcast. Which, by the way, do you listen to that?
Yeah, but not everyone.
I'm now listening to everyone.
Okay, yeah.
Yeah, you should start listening. Yeah. It's like, it's worth it for like the most bullish AI takes out there, right? But, and also like they have Eric Schmidt and they have like Iman Mostek, and, they have like really top-notch guests, so you should start listening. They found this post that I then found on X, which said that Opus 4.5 was trained on like this 14,000 token document that actually this guy was able to extract out for like $70 or maybe $700 of API calls. I can't quite remember, but a 14,000 token document that like basically says that it's like leaning toward, it's not explicitly true that Opus is saying it's a moral client, but like it's heading towards the space of like having a soul. Right. And of course we know it's a math model that is predicting the next token, right? Yeah. But like what it's trained on informs what its prediction is like how it's going to perform. And
so explain what this 14,000 tokens is like 100 pages? Or I mean, it's like you could. It's not a million tokens.
A token is more than a word, but less than a sentence, right? So
So it's 10,000 words.
No, it's 14,000.
14,000 to 20,000 words, something like that.
I would probably call it 25,000 words. Yeah, 25 to 30,000 words, something like that.
And that's what it was trained on.
Yeah. And you can get it out of the model.
That's one of the things, or that's the only. Okay, okay. So they like prioritize that.
Yeah, but this is the thing in Anthropic, right? I mean, the thing in Anthropic is they're trying to align the models with humanity, right? They're trying
to be a good actor,
correct?
Almost in the inverse of OpenAI.
Yes. They're trying very, very hard to be like, it's important that we understand we are messing with some serious stuff here. Right. And we need to try to be as benevolent in our work as possible. Yeah. Right. On top of that, the code that this thing generates and just the way it performs and the way it's able to like, that's what I'm using it for right now. The way that it's able to sort of switch out of different roles is unreal. Yeah. Unreal. Yeah. So anyway, listen, if you're out there looking for a model that's going to blow your mind, Opus 4.5, Claude is
Opus 4.5 is great.
Crazy good. All right, final story. Teens are saying tearful goodbyes to their AI companions. Chatbot maker Character.ai is cutting off access, citing mental health concerns. I think citing legal concerns. Yeah. Because they're getting sued to oblivion. Teens are distraught. I cried over it for days.
Yeah. Yeah. So they're addicted to communicating with this technology platform that pretends to be their friend.
Yes.
And the fact that they are distraught and crying is just more reason that they need to be taken off it. I mean, so I'm sorry that they're upset, but if you're addicted to something that's bad for you, you have withdrawal. But that doesn't mean you shouldn't do it. Yeah.
You have withdrawal. Yeah. So, I mean, to me, I think this is the beginning of,
it's sub 13 years old. So we're not talking about an 18-year-old here. Like 13-year-olds are too young.
Yeah. No, listen, I think this is fantastic. Yeah. I think it's great that character AI is doing this. But the fact that there is withdrawal is worth, like, it's noteworthy.
Yeah, that's right.
That's noteworthy, right? But yeah, I think we are about to see an era of litigation come into AI that's going to be really, really interesting, right? Really interesting. In this case, I think this is a good outcome, right? Because we need to find some way to manage these companies' access to our children. Yeah. And if we can't do it through federal regulation, then fine. Let's sue them into oblivion until they just make sure this stuff is for adults.
I'll just mention, and then we won't be able to cover it fully here, but the Healthcare Council had their party last night. So I was there. I can't think of her name right now, but I met this woman who's a kind of like a malpractice insurance consultant for providers only.
Okay.
And that's interesting, but we were talking about where does the product and medical liability go if you're using an AI system to either assist the doctor or eventually take the doctor out of the loop altogether. And she's in the space advising big health systems. There's no precedent, no answer, no direction. She says there's no way to know. And so it's going to be, we make it up as we go.
Well, it's moving so much faster than
the regulation can keep up.
Than those gears can turn, right? And that's going to be part of the civilizational change that we're going to is we're literally going to be in two different worlds, right? We're going to be in the old world that sort of runs at this old pace,
right?
And we're going to be in this new world where software releases are step changing every day.
Yeah.
Not even every week, every day there's step changes starting to happen, right? And so as the two worlds pull apart, it's like you're kind of going to have to choose which world you really are going to live in. Like you got to be able to communicate across both.
Yeah.
But like which one do you live in, right? And I think that's part of what you and I are have come to a conclusion even about this show, right? It's like we can't cover the old world anymore like that.
Yeah.
You know what I mean? Like it just doesn't.
I'm going to live in the new world.
That's it. Yeah.
If people want to come along, great.
Right.
But we can't translate everything to the old world.
No. Okay. Thanks so much, man. I think we're doing a show next week.
Yeah. I mean, I think so.
I think I'm here.
Well, we're doing a show, whether it's in person or...
I'm pretty sure I'm here. I'm pretty sure I'm here.
Okay,
all right.
good.
Thanks for pulling together, man.